Rivas, you have the floor, please.
Muchas gracias a todos. Gracias, doctor
Thank
Máximo, a
everyone
los miembros de la Organización Panamericana de la
and the
Salud,
members
a
of
las personas de la
PAHO
Universidad de la Florida por la
and
invitación.
the members
Quiero
of
contarles una
FIU for the invitation.
experiencia
I would like
de
to tell
atención
you
integral
today
a
about
pacientes con
the experience
tuberculosis, pero
of
empiezo
integral care in
diciéndoles que
patients
soy una
with TB, but
sobreviviente de tuberculosis.
I'm going to start saying that I am a survivor of TB.
Siguiente, por favor. Resido en la ciudad de Medellín. Como pueden
I
ver,
live
le
in
doy
the city of
gratitud
Medellin.
a la ciudad como
I
tal, a sus
like
miembros, a todo el
thank
sistema
the
cultural por
members
todo lo que
of
me
the
han
community and
brindado,
our cultural
por
system and
las
everything this city has
oportunidades que
given
he
me,
tenido de
the
retribuir con
opportunities
mi
that I have
trabajo
had to
comunitario para
give
las
back
personas que se
to
encuentran
the city
afectadas por
and people of the
tuberculosis,
city with my community work,
que
to all
día a
those
día
people
es
who
la
are
constante
ill
del
with
trabajo laboral y
tuberculosis.
comunitario.
And
Siguiente, por
the
favor.
idea is to have this community
Les presento el
approach.
modelo de atención integral de
I
salud
will show
psicológica
you
en la
the
Clínica
integral
Universitaria
care model
Bolivariana.
that we've implemented at the Clínica Universitaria Bolivariana, where our
De
patients
vulnerabilidad por su piel en
are in a
determinados
context of
criterios
vulnerability because they
eh,
um,
de vulnerabilidad, como
have the
decía,
criteria of vulnerability,
necesitamos
like I said.
brindarles una atención
So we try to give them an integral care with a single visit to our clinic. They can receive all the care that is described in the left panel in order to avoid them to have to travel again and offer them the adequate interventions and care for the follow-up of their disease.
Cuando iniciamos en 2018,
When we began in 2018, the cohort that started with us had 28% cure rate, and we started working with 65 active patients, and we now have 62 people that have been cured, 23% under treatment, and 12% have died. But of that 12%, 10% has died without entering the program. We did a survey of the data, crossed them with a laboratory and other sources. We tried to search for these, follow these people, and they have already died. The other percent were people that died during follow-up, and we only have a 3% lost to follow-up. So you can see the image next to it when we started the program and we gave them the guidelines of the clinic. It's important to be able to give them hope to these patients who come hopeless and frustrated because they have suffered so many difficulties in their treatment. And each of the members of the team dressed in pink and hope so that the people who are affected by TB begin having hope again and that this is possible and that we can help them improve. To each of those persons that are in the program, we follow them by telephone every week, and we there identify aspects that can tell us if they're at risk of being lost to follow up, if they have had any adverse reactions to any drugs, or if there are any aspects of the social environment, or whether we need to reinforce home visits. Not only we do this with the personnel, the people that are active, but also in the people that are on follow-up after treatment. Remember that because of the world guidelines, all patients must have a follow-up after treatment for 2 years. And the goal is to try to improve and guarantee that the registry of those patients in the clinic, but not only at the clinic, but in the department that we are, can contribute all those people that are affected needs to finish their treatment as is indicated. We focus on integrated care, unified care. We always have to think of a multidisciplinary approach centered on the patient. That is why we join our forces and we make this job possible. humanizing this approach in order for them to receive the adequate care that we have dreamed with and that we have been working with. That is the hope we all have. And this allows us to show how we remove the private services and take this directly to the community, because we didn't have any experience as a clinic in doing a community work. And in this TB program, we were able to take this beyond an institution and reach the home of each of these people that are affected. When the people enter the care program, with regards to my job in particular, as a member of the team and then part of the civil society, I actively listen to the people. We hear their histories, how they suffer the disease. They ask me to tell them a story. So we use these um, elements of play that allow us to inform. And we need to have a clear context that all of them can understand, regardless of their literacy level or their social condition. As to the home visits, if you look at the second slide, see how beautiful Medellin is. It's surrounded by mountains, and those mountains, sometimes we have to even climb to the top of those mountains to search for the patients. And that is something that makes this program different. These are not people who are affected because they're poor. It's the problem is that TB leads to more poverty, not only financially, but also physically and mentally. And so we have to care for these aspects in an integrated manner. I always make efforts as member of civil society to work with the affected persons. I try to counsel them and motivate them, and I have to make sure that they comply with all the program. This person was going to go to thoracic surgery, and he said, "Oh, your the others came, but you didn't." But I was going to put in my mask so I could go inside the room. It's important to hear someone who already um, went through thoracic surgery to understand better how the course will be. We also give the affected um, patients, if they follow the treatment adequately, we give them a card for the month so that we acknowledge their compliance with treatment. And when a patient ends the cure according to clinical criteria and has a clinical and bacteriological cure, what we do is hold a celebration. This is a picture before the pandemic. We generally give them a souvenir because they have reached the goal, and we give them a diploma that they can actually keep at home, and where we say you were a fighter, you were able to reach this victory in spite of all the problems. During the pandemic, as has been said during these conferences, we all had to sort of reinvent ourselves, and the program had to make many efforts in order to provide telemedicine support. And we had to send all the information to their homes, the food, help, the graduation of treatment was even in the street. This user without a mask is a patient with special conditions, and so he ad has trouble adhering to this. We had to be in the street to be able to give him this diploma. It was difficult to locate him, and and he said to me, I had TB and I had to take this picture because he wanted to remember the diploma that he received during his graduation, as he saw with the other patients that were in the program. Passion makes us go to the top of the mountains, to go beyond the borders, and to this person had no uh, they thought that she had COVID-19, but during her treatment, the hope was that she could take her picture as well when she ended the treatment. Like I said before, we had to adapt during this phase in samples and specimens collections and to deliver food for nutrition as nutritional incentives. The patients that need to depend on the drugs, it's very difficult for them to adhere to the standards, but we always were able, at the institution, they had to have their masks on, the face masks on. They said, Karen, this looks like whenever we go out, she is looking for us. And so then they put their face masks on. We have designed the program because sometimes we say cure is your duty, you have to adhere to the treatment, cure is key. But adherence is sometimes makes people think that they have to obey what we say. But I want to leave a message to reflect on, and I would like to explain adherence a little bit differently. And I want to replace that word by perseverance because we're actually helping those people to struggle and to try to persevere in that task and go beyond the efforts to reach their target. We're working with the corporation with 5 women. We have created this institution with the goal of providing a multidisciplinary approach to care these affected patients. It has been a very great experience because now we are seeing other leaders uh, joining the corporation. They are really becoming interested in TB. They are living through this treatment process, and we hope for them to be able to know us in a different space with a successful experience. We're always looking at all the aspects of our patients to try to remember special dates because it's a way to make an impact and celebration, and we want to create additional incentives for these patients. Careful listening and to the true needs of others lead to changes that go beyond the cure of one case. The opportunities that start in the heart make an impact, uh, a positive impact on the individuals and their communities. My thoughts as an activist, a member of the civil society, and a former patient is that we need to start listening. Communities need to start listening to the patients and start including them in our work plans to show that community work can lead to changes and differential actions in each of the persons that are affected by the disease. We need to underscore that we not only do this job in the Clínica Bolivariana, I am a true missionary in the area of TB, and I always try to disseminate this to all areas when I'm needed. I always receive messages from people who ask for help because they heard that this program is working well. And so we want to tell you that all those activities is very important for us. Thank you very much for the invitation.